And now it is my pleasure to introduce Acting Director LaBelle, a champion of the Haida program and all of your efforts to combat drug trafficking and safeguarding our nation's communities from negative consequences of illicit drug use. Please welcome Acting Director LaBelle.
Thanks so much, Jamie. And thank you to the Washington-Baltimore Haida and the ADAPT team for hosting this event with ONDCP and the National Haida Program. I really wish we could be here in person, but it's really an honor to speak with you today and to see so many of you who are involved in this important issue. So I want to discuss the importance of prevention, the Biden-Harris administration's efforts to prevent youth substance use, how we can reduce the supply of illicit substances in our communities, the importance of advancing racial equity in our drug policy, and how you play an important part in this critically important work. As you know, in 2020, we lost more than 93,000 Americans to overdose deaths. This is the highest number we've ever seen. And it shows that our country needs a stronger addiction infrastructure, from prevention to harm reduction to treatment and recovery. It also shows the importance of basing our policies and our programs on evidence so they can be effective and save as many lives as possible. One way we can save lives is to emphasize preventing young people from beginning to use substances. The teen years are a risky time for initiating substances, and we also know that the age people start using substances can affect whether they'll develop a substance use disorder later in life. In fact, the majority of people with substance use disorder started using drugs or alcohol before 18 years old and developed a substance use disorder by the age of 20. There's so many factors at play that influence the mental, emotional, and behavioral health in children and adolescents. Poverty, homelessness, parental incarceration, and their surroundings can all increase the risk for youth substance use. But the good news is that research also shows prevention interventions can have positive long-term effects and reduce substance use. For example, ONDCP's Drug-Free Community Support Program, which I know many of you are either a part of or know well, has been funding community-based coalitions nationwide for more than 20 years. And in that time, it's built an impressive record. Since the DFC program began, past 30-day misuse of alcohol, tobacco, marijuana, and prescription drugs have all decreased among middle school and high school-aged youth in areas with a DFC coalition. And our 2019 DFC coalitions have demonstrated significant reductions in misuse of alcohol, tobacco, and prescription drugs. These data show that our evidence-based approach works. And to continue this work, we've already funded 556 grants this year, including 106 new grants. That's a total of $13.2 million that went out just last month for community coalitions working to prevent youth substance use. President Biden has made it clear addressing the overdose epidemic and substance use disorder is an urgent priority. That's why in April, our office released the administration's first-year drug policy priorities. We work closely with many drug policy partners in states, local communities, and in the policy and research fields to make sure our priorities are based on evidence and also meet the urgent challenges that we face to reduce overdose deaths and build a strong foundation for effective evidence-based drug policy. So this includes working to disrupt drug trafficking networks at home and abroad, and expanding evidence-based prevention, harm reduction, treatment, and recovery supports while advancing racial equity. Already this year, the Biden-Harris administration has removed unnecessary barriers for prescribing buprenorphine to 30 or fewer patients and makes it easier for physicians and other medical practitioners to treat patients with opioid use disorder with the standard of care. We've allowed federal funds to be used for fentanyl test strips. That's a key harm reduction tool. And we've also ended a decade-long moratorium on methadone bans, so treatment can be brought to more communities and populations, including people receiving treatment in jails and prisons. We've expanded the Haida program's reach by designated 6 new counties across 4 states and funded the nationwide expansion of the Haida overdose response strategy to all 50 states, Puerto Rico, the Virgin Islands, and the District of Columbia. We provided funding for the development of model legislation for states. This effort will provide model legislation so states can pass laws that remove barriers to harm reduction services, promote equity and access to treatment and drug enforcement efforts for underserved communities. Also, ONDCP has sent Congress a legislative proposal on class-wide scheduling of fentanyl-related substances. This legislation seeks to reduce the proliferation of fentanyl-related substances while also protecting civil rights and reducing barriers to scientific research for Schedule I substances. The President is working to send critical funding to states and communities to support this life-saving work. The American Rescue Plan, which was signed into law earlier this year, delivered $4 billion for mental and behavioral health, and that included $30 million specifically for harm reduction. Most of these funds have already gone out to states. His budget request for next year, for fiscal year 22, calls for $10.7 billion for the Department of Health and Human Services to address all forms of substance use disorder. These are important tools to help states, counties, tribes, and local governments address substance use disorder locally. When it comes to prevention, the administration's priorities include supporting evidence-based prevention, scaling up proven, science-based, community-level interventions, and promoting service delivery models for care that have strong evidence of effectiveness to address the needs of adolescents in juvenile justice programs. Also, the administration is planning to update evidence-based prevention curricula for families of school-age children. That includes programs that can be implemented at home and to identify grants or other opportunities to increase substance use disorder mental health screenings through school nurses, school-based centers, and back-to-school physicals. This includes early interventions, identifying when substance use is getting risky and engaging appropriate care and treatment as it's clinically appropriate. And through our DFC program, we're working with the Centers for Disease Control and Prevention to enhance culturally competent prevention programming and identify opportunities for community coalitions to incorporate strategies to prevent adverse childhood experiences into their prevention efforts. This is an exciting opportunity that will help us build upon the reach of proven community coalitions to create healthy and safe environments for youth. There's more on this in the coming months. So reducing the supply of illicit substances is another important way we can prevent substance use. And the administration is taking steps to reduce the supply of illicit substances in the US. And these efforts include strengthening the government's capacity to disrupt the manufacture, marketing, sale, and shipment of synthetic drugs by addressing illicit internet drug sales and the continually evolving techniques involved in illicit financial transactions. These efforts entail engaging commercial carriers to disrupt the movement of synthetic drugs through postal and parcel systems. Administration supports law enforcement efforts through the Haida program to disrupt and dismantle domestic drug trafficking networks and support initiatives to advance coordination. So a critical part of that involves multi-jurisdictional task forces and other law enforcement efforts to disrupt and dismantle money laundering organizations that fund drug trafficking cartels through the use of the US financial system. Now, I know that Tom Carr mentioned this, but I want to pause again to recognize the terrible loss we experienced on Monday when DEA Group Supervisor Mike Garbo was killed in Arizona while he was working to apprehend drug traffickers. Group Supervisor Garbo was a commander of the Counter Narcotics Alliance Initiative, part of the Arizona Haida, and his loss is felt throughout ONDCP and the Haida program. I send my condolences on behalf of ONDCP to everyone who knew Mike and worked with him. And I want to stress the importance of the Haida program's work to prevent these substances from entering our local communities. In fact, the Haida program has made a substantial investment in supporting prevention. In 2021, regional Haidas invested nearly $5 million to support local and regional efforts to reduce drug use. To support these efforts, ONDCP's Haida program developed the public health, public safety framework to highlight and synergize the continuous efforts of essential partners while synchronizing public health and public safety programs and initiatives. So through this framework, the National Haida program bolsters 5 key initiatives in support of drug prevention, treatment and recovery, and reducing the availability of illicit drugs in our nation's communities. These 5 communities include the Overdose Detection Mapping Application Program, ODMAP, that Tom Carr mentioned earlier, distribution and training on the use of naloxone, the National Marijuana Initiative, the Overdose Response Strategy, and the Haida National Prevention Strategy. So the Haida National Prevention Strategy serves as an infrastructure to guide existing prevention program and nurture new growth and development and prevention in Haida communities. The strategy has 3 simple but really important goals. Establish prevention strategies in all Haida regions, use assessments and research to guide prevention efforts, and sustain prevention strategies in all the Haida programs. Some of the many programs and approaches supported by the Haida prevention strategy will be showcased here today. And this focus on collaboration is important to making progress. Last week, the president issued a formal declaration declaring October National Youth Substance Prevention Month. And in this proclamation, he encouraged all members of the community, from law enforcement to public health to educators and others, to work together to improve the health of our communities. In his proclamation, he wrote, and I quote, "We are committed to preventing substance use among our nation's youth by bringing communities together to find local solutions." That's a real strength of this country, that we have so many ongoing collaborative efforts that take place every day between law enforcement and community-based drug use prevention programs. And we know how vital they are. For example, we've seen successful substance use prevention collaborations between the Haida program and the communities within their regions. And many of ONDCP's DFC grants work with law enforcement partners as well to prevent youth substance use. As I mentioned before, the DFC program, which by its very nature is a community collaboration, has demonstrated results in reducing youth substance use. And one of the greatest strengths of community coalitions, whether they're DFCs or not, is they have the capacity to be nimble and adapt to changing circumstances, like the COVID-19 pandemic, which prevented much of the traditional in-person outreach we're all accustomed to. And that meant getting creative. So one of our DFC coalitions in the Midwest region got creative. They told us they had to cancel multiple prescription drug take-back day events because of COVID, but that didn't stop them. Instead, they provided the community with home disposal options and safe storage ideas until these public buildings reopened, offering access to disposal boxes. So that's just one example of how we adapt to changing circumstances to prevent youth substance use and bring communities together. By focusing on areas where youth learn, work, and live, we can scale up policies and programs that are evidence-based, reduce risk factors, and strengthen protective factors. That's why it's so important to make sure prevention programs that receive federal grant funding are effective, and we need more opportunities for young people to be screened for risk factors for substance use, so we can wrap them in the best programs and supports available and give them every chance to succeed. And it's also incumbent upon us to correct longstanding racial inequity that's occurred in our drug policy and promote equity in healthcare and the justice system. The COVID pandemic has exacerbated the substance use disorder epidemic, and the increases in overdose mortality have underscored systemic inequities in criminal justice and prevention, treatment, and recovery. This is just one example. Black people are delayed 4 to 5 years longer than white people in entering addiction treatment. And too often, access to care in diverse communities is limited. One recent study showed that Black women who experience high levels of trauma, including childhood sexual abuse and other forms of violence, have greater needs for substance use and mental health treatment, but they have less access to care. And when they do access care, it's of lower quality. As a nation, we can come together to do better in this regard. That's why President Biden has made advancing racial equity a key priority for this administration, and it's why it's a key priority for our nation's drug policy. So again, I want to thank you for being here today, and most importantly, thank you for all the work you do. Please continue to work in your local communities to prevent youth substance use using evidence-based strategies to make the biggest possible impact. If you need more information about effective prevention strategies, I know you're going to find out so much more about that today. We also are available at our office to help because we know that by preventing youth substance use, You're preventing potential overdoses, and this is where our country needs you. I hope you'll leave today ready and prepared to push forward evidence-based prevention efforts. Thank you for your dedication and your tireless work on behalf of young people across our country. Together, we can bend the curve on overdoses, save lives, and improve our nation's health. Thank you.
Thank you so much, Director LaBelle. We appreciate your comments. At this time, we are going to conclude this session. If you will close your window for the opening remarks from Director LaBelle and join us on the morning keynote session where we'll be hearing from Dr. Carlos Blanco from NIDA. See you there.